So I'm delighted to welcome the founders of Deepfinity with us today for another episode of the UK AI podcast. So it's a brilliant pleasure to have you with us today, and I'd like you to just take a minute to introduce yourselves.
Thank you very much
Thank you.
for the invitation. Really pleased to go through this podcast. I'm Rama, a co-founder and CEO of Deep Infinity. We are here trying to revolutionize the healthcare and life sciences industries by using Gen AI, LLM, health proprietary models. Yeah.
And I'm Prasanthi, co-founder and chief operating officer.
Fantastic. Well, it's a pleasure to have you both with us today, and I'm really looking forward to finding out more about Deepfinity and what it is you're doing in the AI and healthcare space. So I wonder whether, first of all, we could just kick off by talking about how AI is transforming the healthcare workflow, because in a lot of industries, we look at how AI is increasing efficiency, but in healthcare, we also need to think about the human outcomes. And how do you balance those two things? How do you balance the efficiency gains with the need for human oversight on medical decision making?
Yeah, I mean, it's an interesting question. So if you look at the AI use cases transforming healthcare, there is no doubt about it, right? That's not a question here, right? Everyone agrees on that. So the question here is, how do you balance out? Because each and every patient is unique, and every scenario is different. So you cannot build a common workflow, generalized workflow for a hospital or clinic, or you have many cases like in healthcare industries. So what we are trying to do here is we are trying to make sure that patient is put at the top, and also privacy, security, plus each case, each concept or each workflow is thoroughly analyzed and built in a way that there are several checkpoints where nothing can go wrong, because at the end of the day, patient's life, we are dealing with lives of the patients, and also reputation of the clinician, hospital, there are many things, right? So if you understand end to end the patient journey, clinician journey, then if you know the background of AI, Gen AI, LLM, how best you can use it, where you are reducing the risk to nearly to zero and getting the performance like 99.9. So this is where we are trying to match and trying to bridge. That's why we are succeeding, and we are building on top of this workflow.
Excellent.
Without using this workflow, actually, there is a better chance of losing out the track of the patient records, or after this appointment, then how long it's going to take. So there is a lot of chance of losing the track. So with the help of AI, actually, we can definitely make it to zero, because we will be tracking the patients and then following up and recommendations.
And you saw the BBC article also, healthcare ombudsman 4 days ago mentioned that because of the delay in the early diagnosis, or they diagnosed correctly, but they missed out communicating to the relevant GP or relevant clinician. So because of that, patients suffered a lot, and unfortunately lives lost. So if using the AI workflows, this will help reduce the burden on the clinician, on the doctors, on the patients. This is a wonderful opportunity.
Okay, so where technology is being used is to take over the tasks which are taking away the expertise from the human, and allowing the human to focus their expertise on doing the bits which only humans can do. That's a human oversight bit, and all the repetitive tasks, all the data analysis, all that kind of stuff is what the technology is being able to focus on.
That's correct. Yeah. So we are focusing primarily trying to help, but clinician is always in the loop. In our all the solutions, healthcare solutions, clinician is in the loop, and if we are trying to make it as a checkbox exercise for them, so that they can focus on the top priority things, like for example, like looking at the image scanning, spending more time whether the lesions are there, abnormalities are there or not, instead of focusing, typing or documenting, or trying to worry about communicating to the patient, clinician, various workflow systems.
Brilliant. Okay. So looking at the team then, how do you combine that expertise and bring together both the AI experts and the medical professionals? Because I imagine they're very different in terms of the skill set and in terms of the experience and in terms of objectives. So could you talk us about some of the challenges and some of the solutions you found when you've been bringing those two very different teams together?
Yeah, so like that is the right question. We suffered a lot at the beginning because there is a gap between technologist, like AI technologist versus medical professional, because they are used to certain procedures, certain clinical performances throughout the decades, right? Whereas AI is changing, AI is evolving, AI is getting better, and it is helping a lot of people. So when you are trying to bridge this, documentation burden, image analysis, clinical workflow, doctors, medical professionals are a bit hesitant to understand. They were not sure whether this can help them or become burden for them on top of existing burden. So they were having two minds. So it requires a lot of practice, trust, and also communicating how AI can be effectively used, and removing their pain points, removing their doubts. So there are a lot of things combined here. One is trust, second is time, third is like adapting the scenarios slowly, gently, step by step, so that we get their faith, we get their advantages, we get their trust. So we went through whole journey, and we are in a much better position now. So we are engaging with the clinicians and medical professionals at the wavelength where they understand, by using the trust and all the experiences we gained. Yeah.
And the adaptability is becoming more these days compared to an year ago. So we can say maybe because of the evolutionary chat GPT, everybody is using it. So doctors also, they're finding it easy to use, and also it free ups their most of the time, so that they can spend time with the patients instead of a documentation. That is, they are overburdened. Most of them are overburdened with the documentation, so that makes them easy for them. So the adaptation, as I said, is getting more.
And Prasanthi, how has this shaped the products that you've developed? How has all that experience and insight kind of really changed the way that you might have designed those products?
So the way we designed is actually for the purpose of misdiagnosis, so that patients should not get misdiagnosed. That's the main reason we built this product, because we had some past experience. So using these AI tools, so we are predicting at a much earlier stage. For example, let's say chest x-rays. So x-rays are now, these computerized tools are detecting at a much earlier stage. And then once they find the abnormality, they can be sent to the prioritized separate queue. So urgent cases are separated than the normal cases. So that way it is useful for the patients and also for the clinicians. For example, radiologists, when they see if there is any problem, then they are prompted so that it can be sent to a separate queue, and they are acting upon it immediately instead of wasting time. And patients are also, they will be sent with the update.
Yeah. And how does it work? Can you kind of help me understand where the AI is being used? Is it that the AI is being used to analyze the data more efficiently, or is it that it's actually being able to predict something that it wasn't possible before? Where is the AI being used to help you get those diagnoses?
Correct. Yeah. So if you look at the portability, and the world is changing, like more diagnostic centers are there, more hospital appointments are being allocated. So because of various availability of resources, so a lot of chest X-ray, CT scans are happening compared to previous years, previous months. So a clinician is burdened. For example, a radiologist is burdened to he has to look at maybe 150, 200 chest X-rays, right, on an average, and it is very difficult for them to understand one by one. Where unless until he goes through one by one, he does not know whether that is a serious abnormality or normal, right? So what we are trying to do is, using the AI, we are predicting. We have built proprietary AI models in such a way that it can detect the normal scenario very easily. So this is actually helping clinician to focus on the abnormal cases. If you look at the number of percentage, like only 10 to 20% of chest X-rays are abnormal throughout the world, right? So that means 80% of the time they are wasting, right, on other things. So if we can eliminate the 80% of their time and focus only on the 20% of their time on the top cases, that means they are finding out the lesions, like for example, like if you look at the chest X-ray, atelectasis, cardiomegaly, lots of things are there. It is very easy for them to figure out, understand, because they have time to spend on the chest X-ray to detect the serious cases.
Not only and for finding out the abnormalities, they also have to report them. For that reporting process, it takes about half an hour for them. So without AI, but with it, it just takes a couple of minutes, which makes the process really faster.
Yeah, so I get that bit, in terms of it helping to speed up the paperwork, the bureaucracy, right, and form fitting. That makes sense. But in terms of the actual X-ray itself, how is your system processing that? Is it sort of using some sort of visual recognition system to analyze the X-ray into an image, and then it passes that in as data, and then it looks for abnormalities within that data set?
Yeah, I mean, like we have trained, like millions of chest X-ray images, and as you can see nowadays, like pretty much all the big players have released to open source models, right? So we have our own data on top of open source models. Plus, we train them regularly, we monitor them, we benchmark them. So using those kinds of proprietary models, we are actually tracking them with accuracy, sensitivity, specificity, all those measurements accuracy. So that's how we are able to say, yes, there is an abnormality here. No, there is no abnormality here, and we are confident with the 99.9%, whatever it may be, based on the abnormality detection. Yeah.
Really interesting. It's a little bit of a tangent, but I wanted to kind of see whether this is something that you have come across. Yesterday, we were talking about within AI systems, the lack of diversity and the fact that there are often very large data sets which have been collected from a majority population from one ethnic group. And then actually that means that for diagnoses for people from different minority ethnic groups, there's not as much data going into those systems. I wondered whether this is something that you've encountered as you started to pull in the X-rays, and whether you've looked at any solutions for that particular problem.
Yeah, this is the major challenge, right, from the beginning, and it is still a challenge because due to regulations there are a lot of restrictions. For example, like it depends upon country to country. In some countries there is no regulation. We can build our model based on any number of X-rays, like ethnic groups or age group, various things are there. Whereas in certain countries there are regulations like how many number of input chest X-rays you can use, right? This is like in a tricky situation. Like I understand why they are coming up with this solution, regulators, but it is a difficult situation, and what we are trying to do is to overcome this. We have proprietary models based on the location or region, I would say. So depending upon the region, so our model is used. For example, if we are targeting like South Asia models, then we are using South Asia data. If it is like we have base models with generic global data, on top of it we are fine tuning it with specific region data. This way we are overcoming this challenges. Like there are still challenges.
Yeah,
it is a continuous journey. It is a continuous journey.
Yeah.
Thank you. Okay, and then just sort of looking at the business side of things as well. I mean, one of the biggest challenges I think is around getting scale within the healthcare sector. Famously, there's over 200 different NHS trusts across the UK. I know you've been running a lot of pilots with hospitals, and you've been working with some major players as well. So I wanted to understand what some of the hurdles have been that you found as you've tried to scale your AI solution across healthcare.
So it is still a challenge because as you said rightly, there are 200 tests, and then there are a lot of departments, a lot of people. For example, like radiologists are different, clinician is different. Like we have a lot of hierarchy, and we are a startup, right? So at the same time, we have to go through privacy, security, confidentiality, like data platform, data protection, things like that. So we have to balance out all these things and also buy the trust at the same time, which is time consuming. And in terms of the scaling and piloting, it is a challenging atmosphere. This is a common problem in healthcare,
Yeah.
and especially startups are facing this increasingly. Luckily, due to recent regulations, the atmosphere is changing and favoring SMEs, helping them to do the quick pilots, which is appreciated. We have equipped with all these scenarios. We have built it such a way that adoption can be quicker when we do pilots with, for example, like Wales Innovation Hub, or maybe Scotland, or maybe Kansas X. We are attending the events and we are promoting and we are trying to go through, trying to gain the trust so that
Yeah, it
when we
depends
go to the
on,
pilot, it becomes easier.
Yeah, Prasanthi, were you going to come in there as well?
yeah, building trust, having network and building trust, and then conducting the pilots. And once they are happy, maybe slowly we can, yeah.
So is it a case of having to almost kind of prove some results
Yes,
in
yes,
order to
that's
get the
right.
trust?
That's
And
right.
that's kind of hard though, isn't it? Because that takes time, because famously to get any results,
Yeah.
it's going to, yeah. What
It's really
advice do you,
time consuming.
what advice do you have to other sort of businesses who are maybe sort of facing the same challenge within the healthcare sector? Are there any sort of tips or tricks that you've learned along the way?
So one thing is, like, they have to identify the pain points, right? Like, it's a cycle. Let's say starting from A to B, you need to reach A to B. So you need to identify the pain points, like, what it is, like, you need to brush off. If somebody is telling, oh, you need to go through this route, that route, whether it is really worth paying attention to those points or not. So if you can identify those things, right, then you are in a much better position. You are not wasting weeks and months, right? So for example, like IT department is there. Are you able to answer IT department's questions? Are you in a position to answer? If you are not, go and do the homework, right? Are you able to talk to a medical representative in their own language? For example, like, what is your value proposition? Are you here with a nice AI tool trying to show off, or are you here helping me without talking about the AI technology? Are you helping me? Even if you are helping me 20%, they are willing to consider. If you are talking about AI, all those nice things, then you may be put in the back queue. You will be going in the loop, endless loop. So you need to understand what triggers the medical representative or clinician to look at your solution or pay attention. And also from, hey, as it is healthcare, you need to look at the privacy, security, data protection, and let alone cloud hostage, storage. Various things are there because we have big players like Amazon, Microsoft, Google, Nvidia. So lots of things you need to take care of it.
Yeah, and Prasanthi, I don't know whether this is one of the areas that you kind of look at more in terms of the regulatory and the accuracy and the transparency side of things that Rama mentioned there. That there must be a lot of regulatory compliance. Does that take up a lot of time for you? And how do you manage that on top of trying to grow the business as well?
Yeah, for the speech to text, the radio transcription, regulatory is not that hard, but when it comes to the analysis, image analysis, that really takes months.
And what type of regulations are they that you have to comply with there?
GDPR regulations, DTAC regulations, MHRAs. So there are, it depends
So
on
you
the
need to
region
medical
also,
device
right?
as a software, like you need to classify whether it is, class 1, 2, 3. So, and also NHS has got the, toolkit, like if you look at the nice guidelines, framework, you should be able to go through the, regulations required. And in some cases, it takes beyond 1 year,
Yeah.
Yeah.
Yeah. I think that's kind of really interesting because within the medical space, there are so many extra regulations, which is, we need to have them because it affects humans, but then that must be an extra challenge for innovators. So just to kind of start to wrap things up then, because unfortunately we're going to run out of time in a minute.
Yeah.
I wanted to get your thoughts on the future. What does the future hold? I mean, you're right at the cutting edge at the moment. But what do you see as being the next wave, making the biggest impact in healthcare over the next few years? And how do you plan at Deepfinity to stay ahead of that trend and transformation?
So, we are at the forefront of it, because we're coming from technology side of it, although we have radiologists and clinicians in our team. This is actually a challenging period, and in terms of the AI agents, world is moving towards agents, right. So we actually planned for it, and we are building AI agent, radiology AI agent in the background, combining the chest X-ray analysis, combining the automatic radiology report scribing. Just to give you an example, the moment we see when radiology is reporting, this requires further CT scan because abnormality is not confirmed, then automatically we are trying to book the CT scan for this patient in his locality, and also representing this to the clinician and also to the patient, like workflow system. So these agents are going to be coming all over the world, and they're already there in the software, general software, in the fintech, various places. But in healthcare, it is bit slow because of the regulations and various things, but it is coming. And this way, we're actually making sure that we're on top of the things, and for future proof next 5 years or so. And also I'm part of life care and health services 50-member core group in quantum. So we understand what is happening, what is going to happen in the next 5, 10, 15 years, right? So it will be like, quantum computing is much better in terms of number of permutations and commutations, and also cost effective in terms of training. So we already have machine learning, we already have agents, right? So combining this with quantum will be a better solution and better future proof, and helping both clinicians and patients, and governments, NHS also.
Yeah. And Prasanthi, did you have anything you wanted to add to that in terms of what you're excited about in the future?
Yeah, actually, there are many trials happening with multimodals, we can say. So I think that will hold the future, in near future, I can say. Yeah, there are so many trials happening, and accuracy rate is also higher. So in the next few months, multimodals are going to take the main.
So when it comes to multimodal, if you can explain what is multimodal. So this is when she is saying multimodal, right now we have chest X-ray model is there, CT scan model is there, MRI model is there. What she is talking about is
combining X-ray, CT scan, MRI. So using the multimodal. So
that's the latest buzzword, So
that's what I was telling about. So until now, we are using separate models for analyzing each and everything. But using multimodal, so you can pass through a CT or PET or MRI, anything, and then it will detect you.
Holistic view, patient's holistic view. Let's say patient went through CT scan, also the chest X-ray, MRI, So it is combining all those multimodal and coming to the solution, or arriving a conclusion, or recommendation, or predicting.
So we would be working on that as well.
Wow, that sounds really interesting. I love that, because actually what you are doing at the moment is really working at that cutting edge. Both, almost agentic is kind of the least of those, but you're kind of working on that, and the multimodal as well, which is a real buzzword, but you've got a very practical application for how you bring that together. So, wow, a lot to follow there. And I'll be really interested to maybe get you back in a few more months and hear how it's all going, and how that future has evolved. But it's been great to have you both to join us today on the UK AI podcast. Thank you very much for your time.
Thank you very much, Tim.
Thank you very much, Tim.
Thank you for the opportunity.
It is our pleasure.